bright and sunny today, and always do appreciate and enjoy spending time with you. And if this is the way we're doing it until the meeting in May, when we go to Xenia together, so be it. But I'm looking forward to spending that time with you live as well. Any other early check-ins? Go ahead and make your call. This is AA4FL. It's now time on the coordinate array here for the Marco Digital Voice Net. This is AA4FLJ, your net control for the station. And the purpose of the Marco Digital Voice Net is to provide a discussion forum for current medical events and issues. And this week there certainly are many, some that have arisen in the last few days. And Marco members are here present on the net to act as topic presenters. However, all the amateur community is welcome to check in and participate. Wait one. When we do have check-ins momentarily, again, feel free to check in, even if you don't have traffic to contribute. But when you do check in, please advise me as net control if you do have traffic. So when it comes time in the sign-in list that I call on you to present, but if you prefer to just be a participant and not make a topic presentation or have traffic, that's perfectly acceptable, but we would like you to check in. Wait one. We do have the net acknowledged on NetLogger with a list of those are checked in. In the past, members have found that the IM feature, the instant messaging feature within NetLogger is helpful. So if you look for the Marco DVNet Quadnet array and you find the NetLogger IM and open it, you'll see already that Hilton has posted a link, DY2BBQ, to the YouTube live stream. So I will start regular check-ins in just a moment, but are there any individuals that have emergency priority traffic for the net? If so, go ahead and make your call now. Okay, no emergency or priority traffic. I do see some comments coming in on IM, and I'm acknowledging them. WA8 YXM John, glad that you're here to participate in listening to the conversation. If you have anything that pops up a little bit later and you would like to present, just instant message me and let us know, and I'll get you in the list. Otherwise, I won't put you in the roundtable discussion group. And I see Andy WJ8B is here. Also, N3FJ is at least listening. Are there any check-ins of individuals that are here for short term today, limited because of their time commitments or mobile? Please go ahead and make your call this time if you fit in that category. Okay, this is AA4FL, nothing heard in that category. Before we do regular check-ins, I just want to acknowledge and explain that we do meet Saturdays, local time, UTC time actually, at 1500 UTC. And, of course, that could be Sunday if you're in Asia. But through link repeaters throughout the region, the net is originating today here. I'm using a DV stick myself, and originating from currently Delray Beach, Florida. So as I say Saturday morning and good morning or good afternoon, good evening, please realize that we are an international net. And we do have members. We had check-ins from Moscow last week. We currently don't have any today, but we even have members that check in from Japan. Wait one. With all that being said, if you would like to check in now as a regular check-in, please go ahead and make your call. WJAB. Thank you. Thank you, Andy. WJAB is a 4FL net control. Currently, we have 7 check-ins, and I'll just acknowledge who's here with us today listening. Of course, not everyone has traffic or is going to be making a presentation. The AA4FL, N4TSC, PY2BBQ, N5RTF, N3IM, WA8YXM, WJ8B. So if you're not currently on the check-in list and you would like to be so, please go ahead and make your call at this time. Okay, no other calls here at the time. Before we participate, for those who have not participated previously, just a few housekeeping items and parameters for the net. We recommend that stations using radios enable the busy channel lockout feature if you have one in your transceiver, just to prevent doubling with others, and avoid tailgating whenever using the QuadNet DV network, the open Quad DV network that is. When keying up, please use a 2 to 3 second gap before speaking to allow the link repeaters and hotspots to synchronize with the reflector and other repeaters in this network. Wait one. So it's been a very interesting past few days with some data coming through, but promised data and changes that have been made in the approach to handling COVID-19. So the coronavirus seems to be our main focus. We're not a COVID-19 discussion group. Don't feel that other questions are not appropriate. We're here to discuss anything that's medically related. If you're not in the health field as a professional, but as a consumer, you're equally invited to participate. That being said, are there any additional individuals like to check in at this time? Go ahead. Well, with that, I'm not picking up any additional check-ins, assuming that everything is working well on my side. Occasionally, I don't hear transmissions. Is just for comment, only if you're hearing things that I'm not hearing, please go ahead and disclose that to me at this time. Please go ahead, guys. Okay, nothing heard. I am going ahead and adding entry of Jay Robb to the list, who's hearing the net here today. And again, if anybody is on NetLogger and you want to present a particular topic for the net, feel free to add that to the instant message list, and we'll try to keep track of that. And I did have a comment. I'm not hearing you, Rob. By the way, that's a question. I'm just seeing your post here, but I'm not actually hearing you personally. we could ask if anybody else has copied you from a technical standpoint. Has anyone else in our group copied N3FJ? If so, please let me know. Okay, I'm sorry to pause here for a second. Just trying to let Rob know we're not hearing him according to reports. But we do appreciate you listening, and we're all here to help. It's hard to isolate technical problems on whose end is what. Quite often, the administrators of the QuadNet array are monitoring our net, and they're uh, they're very comprehensive in looking for sources of problems. So again, they're at times finding that everything is operational perfectly fine, but some of us are having technical issues. Wait one. One comment before that, we're very fortunate to have two individuals that are generous with their time, PY2BBQ, Hilton in Brazil, and Chip N5RTF in Mullins that volunteered to record the net and make them available both as live streams and as delayed listening in recording by the rest of our Marco members. We're having a philosophical discussion as to why more Marco members are not involved, but recognize the importance of the recordings in offering these links to our members in our Google group afterwards. So even if they can't participate, the discussions that we're having, they can be pretty. Wait one. As I go through the list and give individuals an opportunity to discuss, as I mentioned, COVID-19 as the first person making a presentation, being here in Florida, again, all different types of approaches are being conflated. You also hear on social media from friends here in Florida that their interpretation of the world is being conflated. Public health is being conflated with social science and political science, and it's very hard to consume when all the facts aren't present, and it's a dynamic situation that changes on a daily basis. So let's all be patient and be considerate of each other, and hopefully we'll all get on the same page and see this diminish. Wait one. As we start our roundtable, in addition to the comments and threads we had last week, in the last few days, we're hearing of initial reports of this particular virus having a much more transmissible characteristics similar to chickenpox, as stated, perhaps with an 8-to-1 transmission in the Delta variant versus the higher 2-to-1 transmission rate, which opens up the possibility of unvaccinated reservoirs of spread, not only from the unvaccinated, but as the time waxes and wanes from the initial mRNA vaccine that the efficacy in totally preventing infection reduces, setting up potential reservoirs for infections and those with breakthroughs. So let's start that out for a thread. I'll start with N4 PSA for NFC. Jerry for comments. Go ahead, Jerry.
Okay, very good, Jay. Perhaps what we need to do, you said have patience, but I think what we need to do is try to get the message across to the public about what's happening with COVID. The alpha version of the virus has a certain transmission rate, and it's been estimated by some the transmission right now with the B variant or B mutation may get worse than even what we're getting with chickenpox. Stand by one. I think perhaps the message may begin to be getting across as we get more people in the general public talking about what's happening. I happened to see an interview with Charles Barkley on HBO yesterday, and obviously he's not a very knowledgeable person about medicine per se, but he's one to speak his mind, and he basically said this, and if I can paraphrase, he said, look, people are stupid, and the vaccine deniers are less intelligent than the average stupid people. And it occurred to me that what we need to do is to kind of make an analogy to help people understand. I think we should make the analogy that the unvaccinated are playing Russian roulette with only one empty chamber and 5 bullets in the rest of the gun. Whereas the vaccinated people may still be playing Russian roulette, but the gun is shooting blanks. You may still be injured, but your chances of survival are far better. And I think we need to try to put this in front of the public and get the media to start talking in terms that the general public can understand. And over time, yes, maybe they'll begin to understand. Anyway, let me turn it back to you, Jay. AA4FL and 4TS.
Thank you for your comments, Jerry. I do realize that there are true vaccine deniers, and there are vaccine deniers from any anti-vaxxers, but there are intelligent people that are not taking the vaccine out of concerns, and concerns that they have, whether they're valid concerns, they are to them, whether they're in reality paranoia is another issue, but still, they're their concerns. Over time, as people experience friends being affronted with a situation, and let me drop one because I have a particular one that came up in a friend this week. I had a friend in North Florida who grew up in South Florida, not far from me, and he and his wife both had gotten COVID in the last 3 weeks, Delta variant. She had been vaccinated, and she had a bout that was serious but survived. And of course, after 23 days, he did not survive. This is not in a vacuum. This must be happening with greater rapidity. There are often going to be families with mixed perceptions of the value of the vaccine. The contrast, if the infectivity rate is as serious as it is, unfortunately is going to be upon us quickly. So I turn that back to you, Jerry, N4TSC, to comment on my comments. Go ahead.
Yes, Jay. N4TSC returning. Let me just make this comment. We are misunderstanding the value of the public health direction of the vaccination. This is not particularly focused on the individual. It's focused on the general population. And the general population does not understand that. So when we misinterpret and talk about the individual effects, we're missing the point. And the point is, this is a public health issue. It's not an individual issue. That will have to await further data, further understanding of actually how this thing works, and it will take time. Back to you. AA4FL and 4TSC.
K3SZT.
Thank you, Jerry, and thank you, Stephen, for checking in. I've added you to the list here. Um, can I just break for a second here? And are there any other check-ins at this time? Go ahead and make a call. Okay, no additional check-ins. Jerry, thank you very much for your wisdom. It is a public health issue. Unfortunately, being compared to a individual liberties issue, and that's not the intent of anyone to affront individual liberties. But perhaps with the shift in infectivity rates, the importance of communal approach versus individuals' rights, and that they do not live in a vacuum where they cannot affect others. I question as to whether or not children coming back to school in the fall as potential reservoirs to bring back home to the unvaccinated will not only amplify this effect, but lead to greater pain and suffering in the near future. That being said, Jerry, we'll continue on down the list here and come back to you the next go around. PY2BBQ, Hilton, your perspective is different from Brazil, I would imagine, and you're always very knowledgeable in general terms of what's going on in the world. Can you impart some wisdom to this discussion? Please go ahead.
Okay, thank you. Let me see if my audio is too loud. Probably not. At that time, I had a wrong microphone turned on. That's why you are not listening very well to my audio. Good morning, everybody. This is Papa Yankee 2 Bravo Bravo Quebec, Hilton from São Paulo. And yes, what we are seeing here in Brazil is a decrease of the number, slowly but consistent decrease of the number of deaths and the new cases as well. And that's related to the vaccination, of course. We have today more than 100 million people in the country that received at least the first doses of the vaccine. That's more about 60% of the adult population and almost 50% of the whole population. And considering that we had about 15 or more percent of the population who had already had contact with the COVID-19, we are reaching a good level of immunity of the population, and that explains the decrease of the numbers. So I totally agree with Gerald that the vaccination issue is not individual, but is a public health matter. And what people need to know is that the only way to decrease the circulation of the virus in the country is to have more and more people vaccinated. It's not an individual issue, of course. And that said, last week, Jay asked me a question. Wait one. You asked me why the Gamma variant, the Gamma strain, is not the prevalent here in Brazil as it is in many other countries, considering it's much more transmissible than the first strains. I think that's because of the background we had here. We had already changed the prevalent strain from the original to
Thank you very much, Hilton. And yes, your audio was much improved on that last transmission. I was able to understand everything completely QSL. You brought up an important point that we haven't brought up this morning. So, in Israel, they're already giving boosters to those over 60 to increase I assume, through their science and research, which we haven't necessarily consumed yet or have made available to us, to increase the response to the Delta variant. Here in the States, it hasn't been 6 months for most people that are vaccinated. So perhaps this is something that's coming. But the comment you made was that a re-engineered vaccine is not necessarily the same thing as a booster. So there can be slight modifications in the mRNA vaccine that allow a booster to not only be a booster, but one that addresses particular issues. And that's something we'll have to be on the watch out for. Wait one. Rob, N3FJ, for just a moment here, if there's a QuadNet array administrator that can listen for N3RJ, N3FJ, excuse me. Rob, go ahead and make a transmission, and even if we don't hear you, perhaps a QuadNet administrator that might be monitoring can tell us more. Go ahead. Okay, I didn't hear you. Are there any QuadNet administrators that are monitoring that might be able to comment if they heard? Rob, go ahead. Okay, nothing being heard. You know, I'm seeing the value of the NetLogger IM feature. Hopefully, all of you are using it because there is a technical discussion going on beyond that of the net of individuals helping each other and making suggestions. And for those of you that are listening to the recordings, I'm not doing this live. You can see usually Hilton has the IM messenger running on the YouTube recording, so you can actually visualize what we're talking about here. This same technology can be adapted to the grand rounds over the air and might increase the value and give people a much expanded forum for discussion outside the confines of what is happening by net control. Wait one. This is the QuadNet array version of the Medical Amateur Radio Council net, the Marco Digital Voice net, which is every Saturday at 1500 UTC. And we have a number of check-ins here. We have conversations going on also on Instant Messenger and the NetLogger. And you can see a list of those check-in if you choose to install NetLogger. Are there any other check-ins that haven't done so already? Please go ahead and make the call. No additional check-ins. So next on our list here is N5RTF Chip. Why don't you go ahead and take some mic? We always enjoy hearing what you have to say.
Well, I'm hoping I get through this time. Yeah, we are back with a date, an indoor mask mandate in New Orleans. They started that again yesterday, so that's going to be an annoyance, certainly for our tourist industry. Question for Hilton, though. Isn't Brazil using the Chinese vaccine? And since they probably had a head start on it, is that more effective than what other countries have? N5RTF.
Okay, N5RTF. Thomas, thank you for the question. This is QI2BBQ Hilton returning. Yes, that was a point of concern for many countries and for us as well. The state government of the state of São Paulo government, which is where I live, did um, a contract with the Chinese company Sinovac uh, back in 1220 and last year in the mid of the last year, and we also participate of the phase 3 research of this vaccine that is called Coronavac, and it's being produced here in Brazil as well, in the Butantan Institute here in my city. It's not the only vaccine given here in Brazil. We are also using the AstraZeneca, Oxford University vaccine in a large scale as well, and Pfizer's and also Janssen vaccines are being given here. But most of it is the CoronaVac, the Chinese one, and the AstraZeneca. Well, what we have seen, we did several studies looking for the effects, the side effects, the efficacy, and the safetiness of this vaccine. And what we found is the efficacy was ranged from 50 to 60%, the chance of getting the COVID-19 when exposed with this vaccine. It's much lower than we see with the Pfizer's vaccine. But the chance, the death rate of vaccinated people, it's almost 0%. And the chance you need to go to the intensive care unit is also very low. And this study was replicated in other parts of the country. Wait one. The same result was seen in Chile, where although it was not a totally, if the chance of getting COVID was not 0 after being vaccinated, the mortality rate became very low, and also the need of hospitalization also decreased a lot after the vaccination. And also, it's an old and very well-known technology in this vaccine, so we all know it's really very safe, very safe. It's being modified now here in Butantan Institute, and they are working in a new vaccine with the covering the new variants of the virus. It's in the phase 3 right now, and it will be ready to general use in the beginning of next year. We know that some countries are not accepting this vaccine, even without any previous study. Like if I want to go to United States, I can travel if I was vaccinated with Pfizer's, but not with CoronaVac. That's a problem for us. And this vaccine is in process to be accepted by the World Health uh, the World Health Association for the I don't remember the name of the consortium uh, uh, to give vaccines to poor countries, and this vaccine will be put in this consortium as well. So probably it will be accepted for most countries in Europe and probably United States for people that want to travel to these countries, which is not happening now. It's being really a problem. But the results are being great here in Brazil with this vaccine. Not a problem with side effects and level of protection of the population is being very good as well. So back to the net control A4FL PY2 BBQ.
PY2 BBQ. Hilton, thank you for elaborating on Chip's question there. I'm going to turn it back to you, Chip, for additional comments on 5RTF. Go ahead.
But as you can imagine, I'm sort of interested in the psychological aspects of this. And there seems to the vaccination rates worldwide seem to vary enormously in proportion to people's trust of their governments. Now, of course, there are some governments that are so heavy-handed that people can't disobey. But if you have a choice, a country like Brazil, and I'm assuming that they trust their government more than the people here in the United States. Probably we have 50% or less at this point who actually trust our government. And that's a source of a lot of the resistance to the vaccine. Now, probably they could find a less lethal way to protest, but I think that does stand behind some of the phenomena in 5RTF.
Thank you for the follow-up, Chip. Hilton, your president, Monteiro, I'm sorry if I'm mutilating the name. I thought I remembered the trust level of the president as low as like 26%. Please fill us in on the differences between trust in the government and trust in public health officials in Brazil. Go ahead.
Okay, Jay, that's a great question. I think there are some cultural differences, and especially regarding health care. That's something that I had already said some weeks ago. I think that countries that have public health systems that are prevalent, the population is prone to accept the treatments like the vaccination as a public health matter and not an individual one. We know that in the United States, the culture is much more for the individual rights than to the whole country people needs, so we always see people asking, well, but I'm 30 years old. Probably if I get COVID-19, I won't have many problems. But this vaccine, this can give me side effects. Why should I take it? Well, the answer is you should take it because you will help to decrease the circulation of the virus in the environment, and probably you'll be helping to protect your fathers, your grandparents as well. And that's the point. That's the point. In Brazil, we have a long-lasting culture of vaccination. We have a huge public health program of vaccination to the entire population. So people is used to be vaccinated in the public health system. It's not something new for us. I think that's why there's not so many people arguing or complaining about vaccination here or doubting of it than we see in other countries. So, A4FL, PY2, BDQ.
Thank you to both of you for the very intelligent line of reasoning and discussion here. From a psychological standpoint, I totally agree with Chip that I'm extremely interested, not being a psychiatrist or a social scientist, but just being an observer of what's going on in my friends and some of the problems and decision-making process. I'm seeing concerns now about immigrants coming from the southern border, being a source of the problem. I think everyone's conflating social science and political science for some reason, again, with public health. Where is this coming from? Is it coming from media? Is it coming from social media? Is it coming from polarization of the American public and the information that they consume? Individuals need to realize that they need to have a balance of information. Perhaps our net here in itself can be a source if you share that information with friends. Hilton makes a wonderful recording that has all the facts and that are being presented, and even those that are just suppositions being presented. But the individuals can then consume that and decide what's right, let it drop one. But going back to the southern border as an example, yes, I'm sure there's individuals coming in, there's plenty, they're not vaccinated, but they're also entering into an environment where there's a reservoir in the American South of individuals that are not vaccinated, that are a reservoir for the spread. So who's at fault for the spread? I mean, we have now, I was vaccinated back in December. It's been almost 8 months, and the second dose 7 months. Has my efficacy dropped to the standpoint where I've got a 20% or more chance of having a breakthrough infection? And if I'm the type of person that travels internationally, on a plane or a cruise ship, am I then a 20% chance of being the same reservoir as an individual that's not vaccinated who's a 100% chance of being a reservoir? These are all questions that are important to ponder. Let it drop one. Anyway, for the remaining discussion, feel free to add to my line of reasoning. Everything else that's been discussed, the next on the list is Keith N3IM. Go ahead.
Yeah, this is N3IM with A4FL in the group. And commenting to your comments, the media and the political environment, I think, has led somewhat to the unvaccinated status of many people, in that they were very negative about the vaccine when a certain person was president versus when we had a change. And I think also we have a large number of people who feel that they're not in the right age group to be overly concerned. But it's interesting to note that of the roughly 162 million people who have been vaccinated and gotten a breakthrough infection, that breakthrough infection rate is less than 0.004%. But I think we have to look at the overall societal situation with the media playing a huge role in the fear of getting vaccinated. This seems to be a real problem. But we also have populations that do not get vaccines, such as the Amish. So that also creates a reservoir. But I also believe that the immigrants who are coming across the border are more highly COVID carriers than we are led to believe, because they're not testing them. they're not offering them the vaccine, and they're sending them all over the country. And I think that's another problem. But politics aside, because this is amateur radio, that's my comments. N3IM is a group. Back to AA4FL.
Thank you for offering those comments, Keith. I am not really familiar with what's being done with immigrants when they come into the country when they're at least apprehended. But you'd like to think that people would be vaccine tested before they're allowed to move on to expose other individuals. Yeah, I mean, the ramifications and the permutations are limitless at this time, and anything that can be done to tilt in the public favor of public health, quality public health, should be done. I still think there's a tendency to scapegoat individuals, and we don't even know the percentage of border agents that are vaccinated. I mean, they're again, the combinations are limitless. When you've got 30 or 40% of individuals that are not getting the vaccine, for whatever reason they choose not to do it, legitimate or otherwise, to be a significant concern. It just adds to the confusion and does politicize the issue, let it drop one. So going back to the public health experience, if we have enough people vaccinated where we have herd immunity, at that point, does this become an issue? And is that the true challenge right now with individuals not getting vaccinated? That we are not acquiring herd immunity and counting on it to occur by infection, which leads to morbidity and mortality. So let's continue along that line. WJ8B, Eddie, you're next on the list.
Well, good morning, everybody. I'm Matt. Let me make sure I'm being heard.
Net control confirms, and the audio is very intelligible. So please proceed.
Okay, well, I'm on a different setup than usual. I'm actually located in Fairfax, Virginia at the present time at my older son's home, and I had to use a different headset on the laptop. Yeah, all the time has been very good. I've used the Russian roulette analogies to try to talk about people that I know into the vaccine. I have also used the other analogy about public health. I've had the best luck with that in people who are, military people or people who are in law enforcement in particular. And I said, well, you join the military, you put on the front line with a gun to save lives after 9/11. There was, 3,000 or 4,000 people that died in the 9/11 catastrophe. And why aren't you willing to take a shot that might make your arm sore to help reduce mortality from the 1.5 million people that have died in this country, not to mention the world? And many of them will die on that when they finally understand the analogy. For people who are independent businessmen who like to do whatever they want, I always try to use the analogies on them. Your customers count, whether they're, Democrat, Republican, whatever race they're from. You need to take this vaccine out there and spread it to anybody because your business is going to be better. And not to mention people involved in restaurants or other public attended businesses. There's lots of people out there that won't go there because they're afraid of the virus. Your business will increase from that standpoint as well. So it's a hard thing. One thing I have noticed in this personal friends is that if someone was hesitant in the past, if they lose a family member or a close friend, that changes their mind real quick. But it's sad to have that happen if people understand. So that's all I have for this morning. And back to you,
Andy, thank you very much for participating while being at your son's house in Fairfax. Being out of state, you're usually on from Ohio, and the fact that you would get on from Virginia is very gratifying to your acknowledgement of the importance of that and your willingness to participate. We have some members that have been in the net before, and I sense a certain amount of frustration as COVID moves on, and certainly there's a minority of them that feel it's our part to make social commentary. I think today the conversation is very well balanced and non-judgmental. I mean, certainly all of us have our individual perspectives, and we're putting them out there for consumption with each other. And, perhaps the recordings of these nets would be of value to our friends who spread through Facebook or social media, not to offer solutions, but just to have more of a balanced dialogue, hearing it from health professionals and those that feel that public health is important. Let me let it drop one. No one is here to vilify another individual, whether they be a Marco member or a member of the community. We're just here to be of assistance and making sure that all opinions, especially those that we can help or impart to be a little more impartial, to consider other points of views, can be made where they may not be hearing all the information. This is a dynamic situation that's changing every day. Again, trust has been brought up by Hilton, and I'm brought up by others like Jeff. At what time do we have trust in others in society? People that are necessarily in the government, but in the public health as a separate entity from government, because it's harming people, individuals, when the individual rights are sometimes seen in a vacuum. It can both be right and both be wrong at the same time. Why are they mutually exclusive of each other? Let me let it drop one. I hate to philosophically wax the name. This is AA4FL Net Control for the Medical Amateur Radio Council Digital Voice Net here. We're going to be 1 hour in soon. We have one more individual to make comments on the list and may have some additional lines of reasoning to pursue. But again, we do have 2 members that record these sessions. There's no reason just because we're small in number that we can't share the recordings to others in our organization, to others in our group of friends, and let them hear the comments and evaluate the worth of them in terms of their individual interpretation. No one's here to force opinions on others. We're just here to have dialogue. That being said, next on the list, Stephen, K3FCT. Go ahead.
AA4FL and the group. This is Steve, K3FZT in Philadelphia. I have almost nothing to add beyond my AIM comments. I got one early enough to hear Jerry's quite clear articulation of the reality that vaccination is a public health measure, not an individual health measure. Hilton's comments from Brazil further amplify that measure, and coming from our southern hemisphere neighbor with a very different historical and political culture, further amplify the reality that public health is everyone's public health, not just yours or mine in New York or Philadelphia or Florida, but the entire globe's public health. And that, too, is a challenge because there are more than a few, particularly disastrously at the moment in Southeast Asia, probably as well in Africa where there is less information, in which the disease is running rampant. But public health speaks to the polity, to the general public, and inevitably, when you address the general public, it's a political activity. So we may denounce the politicization, and indeed, it's been extremely challenging. But the reality is, talking to the general public is a political activity. So with that, I'll shut up. I'll say 73 to everyone on the net today, and appreciate listening to all the comments and observations. This is Steve in West Mount Airy, Philadelphia, K3FZT, clear and listening.
Break. N3IM. AA4FL, are you available?
Keith, I can hear you.
Okay, I'm not hearing Jay at all, and he doesn't seem to be transmitting. I'm not sure what the story is. I was just going to ask Steve about how he fared with the tornadoes that hit southeast Pennsylvania. I don't know if he's still on or not, but I thought I'd ask him and see if he was affected at all. This is N3IM.
N3IM, this is K3FZT. Thanks for asking, Keith. Personally, and in my immediate neighborhood, there was no real effect of from any tornadoes. According to last evening's news, the National Weather Service for the area reported 7 different tornadoes ranging from EF1 through EF3. There was a single EF3 in Bucks County in the Bensalem Trevose area. The grading of tornadoes is apparently based on the damage incurred by structures, and from that, an estimate of the winds is developed. I have no idea how that's done, but it's not accomplished by actual measurement of winds. So that's the extent of my knowledge of the local situation. There were storms across Long Beach Island, tornadoes across Long Beach Island, and then Rehoboth Beach, Delaware, but they were lesser EF1 level storms. Back to Jay, AA4FL, and the net K3FZT clear.
Well, I think uh, I think Jay is not available. This is PY2BBQ, and I'd like to say thank you for every one of you. And I'll have to leave the group. I'm not sure if Jay will be able to come back. But anyway, I'd like to say thank you to everybody. That was very nice today, the discussions. And it can be summarized like this. I think every epidemic starts and ends the same way. It's starting catching everybody because nobody has immunity against that agent, against that virus. Then it increases with number of infected people, and then when we have the herd immunity, it starts to decrease to the point that it doesn't end, but it reaches a stable level of new cases that are those people that still don't have immunity. Well, we can do it two ways. We have two different directions to go. One is to achieve the herd immunity by a lot of people being infected and a lot of people dying. The other way to go is to have the herd immunity by uh, immunization, immunizating the population with the vaccination. And then we will avoid a lot of deaths and a lot of money wasted with health care that could be avoided with the vaccines. So, thank you, everybody. I'll leave here the space for A4FLJ. Not sure if he's coming back, but I'm surely will have to leave you 73s, everybody, from PY2BBQ.
73, everybody, from N3IM. And thanks for everything you do for us.
This is N4TSC. I'm not sure whether Jay is available. He did say that he was having some problems with his connection, and so that probably accounts for his unavailability at the moment. I would just make one comment, if I may. When Jay said something about political science and used it in the same sentence with medical science, I have to comment that I think of political science as an oxymoron, something akin to giant shrimp or military intelligence. Stand by one. Also, I want to throw out that it's been reported that in Israel there is now availability of a treatment from pharmacies in Israel using nitric oxide aerosol to treat the COVID and SARS-2, and it turns out that it's the dosage schedule has not been reported. However, it's been reported to be useful as a treatment in other respiratory diseases. And then the last comment I would make is that masks and vaccines should be promoted as extra protection, like wearing a belt and suspenders. Therefore, it's foolish from a public health perspective to restrict mask use even among the pediatric age group, as our governor in Florida is advocating at the moment. Anyway, Jay, if you're there and you can respond, go ahead. Otherwise, I'll say 73 and thank you for running this meeting again today, and perhaps we'll be able to hear you tomorrow on the main net. AA4FL and 4TS.
Know that, yeah, Jerry's talking about oxymorons. I agree. I just want to make sure, Marco, that the ionosphere is not the oxymonosphere. An old joke from a 1970s spoof movie there. Andy, have a great week. I'm going to say 7-3, and thank you for your participation.
I have a weekend list. Wait here for a moment. I just not yet testing here. I'm not sure everything's clear. So we got a little weekend for you to be clear.
73 and 5 RTF clear.